Anyway, so I'm really honored I get to introduce you today to Tiffany Yang, and she's from City of Hope, and she's a children's certified child life specialist. And she's going to talk to you today about speaking to your children and grandkids about cancer. So with that, I give you Tiffany. Thank you.
I'm going to try and make this efficient so you guys can all get to your cocktail hour, okay? You can go if you like. This is being recorded. You can watch it later. My name is Tiffany. Like she said, I am a certified child life specialist at City of Hope. I think many of you might be familiar with City of Hope. I will tell you that we do not treat ocular melanoma at City of Hope. However, we are well connected with the local hospitals, UCLA, USC, who have very wonderful clinicians who do treat ocular. But has anyone heard of Child Life Services? By show of hands. So this is a very special service that is available at City of Hope and many children's hospitals. It's growing now in larger adult hospitals. But essentially what I do is I provide education to children and adolescents on a number of diseases and procedures to help them cope either with what they're going through themselves or what their parents or grandparents or a significant adult in their life is going through. So. This is me doing some of my education, and I'll talk more about that. But I started off at Children's Hospital, Orange County. Did a number of services there, whether it was radiology, emergency room, ICU, medical surgical unit, things like that. But I found a passion in oncology care. So I was fortunate enough to find a position at City of Hope where it's strictly oncology care. So just a quick disclaimer, this is strictly voluntary. I was brought on by the social worker that was talking next door, Jennifer. But I just wanted to put out there that the views and opinions expressed herein do not state or reflect those of CHOP Children's or City of Hope. I'm currently practicing as an independent certified child life specialist. This presentation is for general information, and it's not to substitute. So if you want very specific clinical or healthcare advice, please go back to your institutions. I'm happy to give you my contact information if you need help navigating that, but I can try and find a child life specialist at your institution or a nearby institution that might have a child life specialist, okay? So quick review of the agenda. What is child life? I was hoping to, I did a little bit of research on my own on what ocular melanoma is, but I like engagement and interaction and discussion. So if there's something specific about ocular melanoma that you're going through, I'd love to learn more about it and find a way on how to describe to the children that are in your lives what you are specifically going through. How I do age and developmentally appropriate education. How I teach coping skills, and then if you all had some general questions for me. So child life, I mentioned a little bit about it before, but we have an association of child life professionals. There are child life specialists across the nation and internationally. So if there is a hospital that wants to have a certain certification, they have to hire and employ certified child life specialists to meet some of that criteria. But essentially we use play, preparation, and hands-on education to teach children and adolescents really complex concepts and to learn to cope with challenging situations. So it's like, how do you even talk to kids about the complexity of cancer, right? For a 5-year-old's brain to even process and then to even deal with that, right? So this is primarily my job. So ocular melanoma, what is it? So I learned that it's essentially what you see here, tumors, cancer that grows in certain layers in the eyeball. Is that correct? Yeah. And what causes it? So in my research, I heard that it is somewhat of it could be genetic, it could be a DNA misconfiguration. Can you tell me a little bit more if you know beyond that?
They don't know.
Okay. Yeah, so it's a very common for cancer diagnoses to say, what caused it? Was it something I ate? Was it from my parents? Was it from, something else? Was it something I did wrong? Maybe, and God's punishing me for this. I've heard all kinds of things, right? And so when we're trying to teach children and adolescents, they really want to know a root cause. They're very literal like that, right? And it's hard to say, I don't know where it came from. And sometimes that uncertainty is so mind-boggling for kids. And so how I like to, well, I'll talk a little bit more in the next one, but I'll talk a little bit more about how I can bring more of that certainty and give them an example of where it might have come from. And that might settle them for a little while. Symptoms? So I heard blurred vision. I just learned a new term, there's a ghost eye that might happen from the cataract, right?
Well, that's from the treatment,
Yes.
From the radiation treatment. My daughter literally woke up blind with it.
Okay.
That's how she found her.
Loss in vision. What else? Dizziness, I hear.
I just had kind of a brown haze in the lower third of my eye.
Yeah.
And after a week, I saw it there with a check.
Yeah. So it's kind of like a cloud that's floating around, sometimes a haze.
I had a fireworks show.
A fireworks show. Yes, I heard about the flashing lights that you could possibly see, right?
Yeah.
Anybody, any other examples of what you're experiencing? Okay.
There's no real symptom.
Yeah,
It's
so
just,
the reason why I ask about symptoms is because children will want to, well, in order to help them cope with what you're going through, it helps to teach them what you're actually going through. So what Child Life does is, let's say for example, if I'm teaching a child whose mother has this ocular melanoma and the mom is experiencing the haze that you're talking about, or the dizziness or whatever, I'll try to mimic some of that, those symptoms for the child so they can see that that's what mommy's going through. Like, how would you feel if you were doing that, right? So an example that I would do is I would take saran wrap and I would cover one of their eyes. And then in a safe environment, of course, I would have them walk around and see how it feels. My new friend here says that she has no peripheral vision on this side, right? So I would tape a piece of paper right here, like it's super easy. Tape a piece of paper and say, can you see anything on your right-hand side? Mommy can't see that either, okay? So what I need you to do is be really careful, and if you're walking on this side of mommy, to tap me gently on the shoulder or something and say, mommy, I'm right here, right? So these are like tiny little examples of how you can teach your children how to help you, but also understand what you're going through. Okay? Yes?
Quick suggestion for you.
course.
I carry a CDL.
I'm sorry?
I carry a commercial driver's license.
Okay.
At least I did until I retired. But CHP at a lot of these fairs and events, like the county fair, they will have a trailer come in.
Oh, yeah.
And they have computers, driving simulators, and they give you a pair of glasses.
Yep.
Contact one of the CHP office and see what you can do about
Yep.
getting a couple pair of those.
The drone goggles,
The drone-
right?
Exactly.
That's exactly what I'm replicating, though, in my
Yeah.
point. Yes,
And
exactly.
You put those glasses on, and I
Yeah.
put them on, I wore them for about a minute, and I said, I can't even do this.
Yeah.
Because my head was spinning.
Yes.
But it's a good simulation
Yes.
and hands-on
Yes.
tool.
Yes.
That you can give the kids, let the kids try it, and
Yes.
then walk with them.
Yes.
And it's something not, it's a resource for actual demonstration
Correct.
of what happens.
Yes.
And even though it's not what you're trying to focus on, it gives them an idea of what mommy or daddy or Uncle
Exactly.
Joe is going
Correct.
through with eye problems.
Exactly. That's the whole purpose. Like when I'm doing education in the hospital, I'm looking. You'd be surprised. I use whatever I have in the shelf in the storage room at the hospital, and I'll look and see what they have. And Child Life is trained and skilled that way to say, you know what, I'm going to put that gauze over her eye. I'm going to show her what it's like to have blurry vision, or I'm going to take these Band-Aids and I'm going to stick it here or whatever. But I use all kinds of stuff that I can readily pick at to show the kids, like, this is what they're going through. How would you feel if you were going through that? And talk to them about it. And then empower the children to say, oh, you know what? If that's how mommy feels, maybe I can, maybe I can. And they come up with their own answers on how they can help mommy or daddy or whoever is in their life that is going through this. And so that is part of the profession of Child Life. Yeah. I think that's great. Perhaps we can make a suggestion on the next Ocular Melanoma conference to have a simulation truck for caregivers, even newly diagnosed patients or people, and to have their caregivers get an idea of what their lover or partner is going through.
I had no clue until I also had eye
There
surgery.
you go.
And they patched one eye, and then I had to go through a buffet
Yeah.
with it patched.
Yeah.
And
Yeah.
they
How
gave
was
me
that?
They gave me a clear plate to eat. The buffet did. It was kind of fancy.
Yeah.
And probably about 75% of my food
Fell.
wound up on the floor because I missed the plate trying
Yeah.
to serve it with one eye.
So if we can
I never appreciated what she was going through until then.
Yes.
Truly appreciated it.
Yeah. So
As I do.
if we can teach our children about this, I think they'll cope better with what's going on. Okay. I think if we're honest and open with them about what this is, they can cope better. So I wanted to mention treatment here because there's a number of treatments that you all go through, right? And it can range from chemotherapy eye drops, it can surgery, radiation, those kinds of things. And although you're treating this particular area, I heard that there's a lot of treatment because this disease often metastasizes, spreads to other areas where even further treatments are needed. Okay? At City of Hope, when I'm talking about treatments, I literally will show in an age-appropriate way what treatment is like and the symptoms that may occur after the treatment. So for example, radiation. Although there's radiation happening here, depending on your metastases and where the location's at, if you're getting radiation elsewhere, it can cause things like sunburn, bone ache, lethargy, right? And so when I talk to the kids, I'll say, you know what? Mommy's getting really tired right now. Her skin's a little red. That's normal, okay? Or not feeling well. Nausea comes with it too sometimes. And when the kids learn that this is normal, it doesn't fear them that much when they see it actually happening at home, okay? And say, you know, for a little while, I'm using mom, but I'm going to interchange that. Whoever your significant adult is for the child. When mom's doing that, that's normal. That's, she's going to feel that way for a little bit, but she's going to feel better afterwards. And the doctors have given them medicine to help with this or that, right? But to tell them that ahead of time so they can anticipate those symptoms is what's going to help them cope better with what's going on, okay? Had you not told them and they're seeing mom like knocked out on the couch from treatment, they're going to be like, what's wrong with mommy? And they might come up with all kinds of stories depending on their imagination, right? We want to decrease some of that and say that's normal, okay? And this is what you can do when mommy's feeling this way and empower them again. And when they're able to make their choices and their decisions that way, they feel more confident and comfortable, okay? So education, I've already talked about a lot of these things, but these are some of the tools that I use when I'm teaching about cancer and different diseases. When I mentioned earlier about why this happens, typically I'll go to this example of the cell and DNA, and the way that I describe it is that, see the matching, I'm going to take this. Hello. See the pairs in the DNA? So the yellow matches with the red, the green matches with the blue, okay? I talk about cells and how they grow and how they are programmed to do certain things. They help us grow hair, they help us grow eyeballs, they help us grow different things and keep us healthy, right? But sometimes cells are broken. And here, sometimes the yellow and the red, they don't match up properly. So they make the cells really confused and the cells don't know what to do. So typically, when a cell is working properly, it starts as a little baby, it grows, it does what it's supposed to do, keep us healthy, and then at the end it dies, okay? But guess what? Our body makes new cells every day to keep us healthy. So it's okay that some of them die. But when a person has cancer, and these things don't match up properly, the cell doesn't know what to do, and so it doesn't die. It stays in the body, and it makes copies of itself, okay? And in combination with this education, I bring out the Play-Doh, and I make little balls of cancer cells, and then I clump them together to make a tumor, and that's how I that's how I describe how this creates. The tiny little Play-Doh balls, and using things like Play-Doh makes it less scary because it's a familiar toy, it's a familiar item, right? And so that's how I connect the, mom inside her cells, her DNAs, it didn't match up properly, so it's working funky, okay? And it's working funny, and so this thing grew in her eye, and we're going to try and fix it, okay? So just a quick given the time that I have, but just a quick way of how I use pictures and familiar things like Play-Doh to help do the education. Does that make sense? Questions? Okay. So I like to use real life eye models too, or bones. I have like fake bones. I have all kinds of fake body anatomy parts because the visuals are what's helpful. I'll take the Play-Doh and I'll stick it in the eye a little bit right here, okay? And then I'll talk about how it's not supposed to be there, okay? Literally showing them where it is and what it's doing really helps with the education, okay? This here, anybody familiar with that?
Radiation.
Yeah. That looks really scary if you don't know what it is, right? Why does mom have to have that, okay? And the reason why I actually do teach about this is because sometimes, in my experience, the caregivers and the patient, let's say for example, may not have a babysitter, and so they'll have to bring their child to the appointment, right? And so while they're there, I might educate them on how we're trying to fix this, how we're trying to fix that, and showing them in a not so scary way what that is and what that's doing and how that's helping mom or dad really, really calms them down and helps them understand. And so next time, if mom and dad are going to treatment, they have a visual of where they're going and they're being taken care of and they're okay. Versus, why is mommy not home? Where'd she go? When is she coming back? You know, the fear of security, right? And depending on developmental age. And so if we can, upon the first visit or first couple of visits, do some education like this, when you go to your next appointment, they'll know, oh, that's where they went. Oh, okay, bye, see you later. I've heard that before. You know, I know where you're going now. I'm familiar. So go ahead and I'll see you when you come back. And you tell them when you're going to come back. Okay?
Do you also educate the kids about their own melanoma?
Yeah, I do. Yeah. So we have a very large pediatric unit, and we will teach the children about what they are about to experience. So one of these, this is my Medkin doll, that's the brand name, Medkin, and this is a port for chemotherapy. And so if a child is going in for a port placement to start their chemotherapy, I teach them about what's going to be put into their body, similar to what's here. They get to touch it, they get to manipulate it, they get to see how they're going to get their medicine. This doll has all kinds of Velcro attachments depending on what is going on to the child or what they're going to experience. And so, another teaching tool that I use. Okay. Here is the play aspect of education. So I have some children who are preparing for surgery, right? What are these hats that I have to wear? What are these gloves? You know, people, based on what they see maybe on TV or at a doctor's office, it can be scary, right? So we make it less scary by doing play with the actual medical equipment, right? Nothing dangerous, but just seeing nurses come by, they know that those masks are what they're for, what the gloves are for, all that. And so when we normalize and we practice and play on teddy bears like that, it makes things a little bit better. Let's say, for example, if you have to go in for surgery and your child's there sending you off at pre-op, right? Sometimes I'll work with the kids right then and there, and before you get rolled in for your eye surgery or whatever, they're not as scared because they're familiarized. We've made it a good thing. All this medical equipment, all this craziness. Okay, I've done pre-op education where you come a day or two before surgery, and I'll navigate you through what pre-op is like, and do familiarize the child or you with what's about to happen, and what are these things here and why they're important. So we end up doing like a look and see kind of a thing, so that on the day of, it's not as scary. Nothing is like super brand new. Any questions so far? So coping skills is really important part of child life and helping the patient and the family. I have a few examples here, but there's all kinds of things depending on your particular family situation. But one of the things that I often teach about is something called open-ended questions. So especially if you have teenagers, it's really important to ask them questions that are open-ended that'll keep the conversation going. How was school today? Fine. Closed question, right? How was school today? Yeah, fine. So instead, open-ended questions. Keep them going, or make them describe a little bit more about how things are going. Okay. Notice unusual behaviors. So if your child is like super active and really inquisitive, and then all of a sudden they're really quiet, they would rather play by themselves for now, you know, or they're not being as rowdy, that's something to look into and say, you know, what's going on. Okay. This mug here is probably more of an old school approach, given that people now have like cell phones and stuff, but there's this little story about this family who kept a mug in the middle of the house somewhere where everybody knew where it's at, and you would throw notes in there, questions, things that you were scared to ask in person, and so it was a safe way to pass messages along to each other, where it wasn't like confrontation, like I'm too scared to ask mom this, so I'm going to write it and I'll put it in the mug, and mom knows to go get messages from the mug. And that's how you would communicate with each other. Obviously, this is for school-age children who can read and write, right? But it's an example. Nowadays, people are texting to each other. They're sending text messages back and forth. And, you know, for me, it's more about whatever way to get the communication across. Better than that than to not talk at all, okay? Because the not talking at all shuts down the roadways for feeling comfortable to ask questions, because if they don't ask you the questions, they're going to go find it somewhere else. And this is another reason why I have the Google search right there. Google is not your friend. Google is also not your friend, not your teenager's friend or your school-age friend. If they have access to Google, I would rather you be more aware of what they're searching, because what's on the internet is not always true. Okay, especially working at City of Hope for over 7 years now, I've learned over time that the statistics aren't true. I'm going to be real. I've seen so many people survive and do well outside of what their statistic was. And because of clinical trials, because of the research that we're doing, not just City of Hope, elsewhere too, right? The advances in all of this, okay? That the statistics may not be true for you. And so when you go onto Google and you're searching for things, okay, what is that causing? Just unnecessary anxiety and stress, because you're reading someone else's story. You're reading someone else's things. So knowing that you guys all have direct connections to your healthcare providers and a wonderful resource like a Cure Insight, reach out to those people and get some more information. Okay. So if you're not monitoring your children or teenagers' web searches, try to now. I would recommend. Okay. So I really like this one, the toy box. I have some patients, adult patients, who, like the example I gave earlier, where radiation really put her to sleep. Like, she was so tired, it made her feel really lethargic, and her child kept saying, "Mommy, why won't you play with me anymore?" So there's a big change in their family dynamic, right? And how to mediate that just temporarily was I recommended that there's a toy box be made, and it's only the toys that she can access when mommy is feeling sick. okay? And so the things that are inside the toy box are exciting because I don't usually get to play with those kinds of toys, okay? And so it's just a tiny example of the things that you can do when you are not feeling well, when you're going through treatment, and you just need that quiet time, but you have a little one that needs a lot of attention, right? This is just a quick example. Have a special area in the house where that's where you go, or that's where you play when mommy's feeling sick. And it's exciting because those aren't the toys I usually get to play with. Does that make sense? Questions? I was wondering if I can get some real examples right now of any difficulties you guys are all experiencing with the kids or the teenagers right now? Or is this just information gathering? Yes?
Well, I'll share that probably the hardest thing that we went through was not being able to be around my children for a week.
Mm-hmm.
Yes.
And that was the hardest thing. You know, my daughter was 10 at the time, and I have a 14-year-old and an 18-year-old, and for an entire week.
Was it because of the radiation? Yeah, yeah.
They couldn't be in the same room as me.
Mm-hmm.
We ended up, my daughter and I ended up watching a television show in different rooms.
Yes, wonderful.
And texting each other during
Yes.
the show, but that was the only way that we could be together for the whole week.
Mm-hmm.
And other than that, the biggest thing was I let them come to the oncologist, and they got to hear from them that it's not hereditary.
Uh-huh.
It's something that just happens. You're at no more risk because you're her child than the fact that she gave you blonde hair. So,
Yeah, yeah. So in that instance, there's all kinds of things that you can do nowadays, FaceTime and those kinds of things. But that's exactly what I would suggest, being on the telephone with each other, but watching TVs in different rooms. And then the education portion falls into this, where you need to say, it's actually for your safety and your protection. Because the treatment that mommy needs right now, it's not good for kids, right? And so the reason why I have to be away for a little bit, I'm just right here in this next room, but the reason why I have to be away for a little bit is for your safety. But right after that, we're back together again. You know, things, those kinds of education. I love that you took the kids to the oncologist. A lot of the doctors that I work with, I have to like prep them and coach them a little bit because they're so smart, right? These clinicians, that they don't know how to talk on kid level. So sometimes it goes whoop, right over their brains. But I love that they were there, they were able to talk and learn a little bit more about, this is not something you can catch, that's a big one. Cancer is not something you can catch, because we often associate the word cancer and being sick, right? This is not like catching a cold and a flu. If mommy sneezes on you, you're not going to get her cancer. That's oftentimes one of the main things that I have to share. And so yes, I commend you for doing those certain things.
Well, I just wanted to use the carpool. So that's why I took.
Say it again?
So I could use the carpool lane in order to come.
Oh, to go to the alcohol. But look at the what happened, right? Right after that. That's funny.
It is
Yeah.
When I had the radiation patch on, I
Yeah.
took a picture and sent it to our grandkids who were 3 and
Yeah.
9 at the time in Texas. And I sent them sunglasses. They cut off one of the eye
There you go.
portions and took pictures and sent it back so that we were all proud of it.
Yeah, yeah. So go ahead, sir.
One of the things that my wife alluded to, our older grandson has retinoblastoma.
Okay.
So he was familiar, and when he was showing the port for them getting their medicine, as a baby, he was there.
Yeah.
He was only 10 months old,
Yeah.
but he knows.
Yeah.
You know, he's 10 now, he's cancer-free,
Uh-huh.
but has almost no vision in that eye, but he's totally adapted.
Mm-hmm.
And, you know, his parents have been very open with him,
Wonderful.
you know, what he had, and
Yeah.
he's
I do
treated and cured, and he's fine.
I do encourage the honesty and the transparency. You would think that, oh, a 5-year-old's not going to understand, but truly, sometimes the little ones are the most observant of what's happening. Why is mommy acting this way now? You know, why is she changing? They pick up on these things. They pick up on when you're sad too, and they're like, what's going on? And so, don't underestimate the little ones.
They think they did something wrong.
Yes.
And that's why they're not.
Correct.
responding.
Correct. I've had many children. Okay, so I had this one child. She admitted to me, because she was too scared to tell her parents, she said, Daddy asked me for a cup of water and I gave it to him in a dirty cup and now he has cancer. And she'd been sitting with that for the longest time. And how sad is that, right? And so if we can just say, no, that's not what happened. That you didn't cause this to happen, right? The change from just that simple sentence, it's not your fault. This is what's really going on, right? Changes her perspective, yeah.
First thing he did, he put on the stethoscope. You need a poke?
Because the poke is the most memorable and the most scariest thing ever, right?
Every other minute, you need another poke.
Because that's what's going to make you feel better, right? Yeah. I do normalize pokes. I love that you use the word poke. I never say shot. I never say, needle. A little pinch. So it's all about using euphemisms a little bit to make it not so scary.
Well, that's what this pediatrician and the surgeons.
They use the
It was a children's hospital.
yeah.
Treated by doctor.
Wonderful. So, but any other examples of how are the kids doing now? Can I ask?
So they struggle with it sometimes. I'm not quite a year out, and so we just kind of wait and see what happens. But my vision, that's what they struggle with the most. That I have difficult time like seeing them to the side or they're not comfortable everywhere. So, but for the most part, they seem pretty well with it. They only had one other family member as a frequent reference for having cancer that was
Yes.
very quickly
Yes.
diagnosis. So that kind of shook them. It was only a year prior to my
And you said that it's very different, right? The
Oh, yeah.
cancer, and that's actually a common topic that comes up in the education that I do is that so many people have cancers these days that the kids are like, you mean like you have cancer like how grandma certain-so had cancer and then they died? And so it immediately goes there. They're only frame of reference, right? So I often am doing education about how different all the cancers are and how different people respond to treatment, right? I have 2 people with leukemia and one does really well and one doesn't, even though the statistics say they both wouldn't do well, And so I bring in a lot of that education portion about how different it is. What is it about your vision that they're struggling with? How does it impact them?
It impacts them. Like I don't like to take them to places at night.
Uh-huh.
It's hard to see. And so like in the winter they don't play their sports and stuff. And so it's like we're gonna have to figure out how to make sure fun this like because it's hard for me to see. So that that affects them. And then to the others, I don't like to be in public places like Walmart. And because who wants to go to
That's the
Walmart?
truth. That's the truth.
But I had a really bad experience where somebody like really yelled at me during Christmas time because I was looking at this crappy paper. And it's like, oh my gosh, it's not a 2x4, calm down. But it embarrassed
I think that's
me.
typical Christmas time in Walmart, though. Even with perfect vision, I'm hitting people with the wrapping paper. But yeah,
I just don't like going
It's-
to those places and like.
you're self-conscious now.
Yeah.
Yeah.
It's very busy places are for you. I'm like making sure somebody's on that side.
How old are your kids now?
They're 11, 15, and 19.
Okay.
And then now we're together, and then his daughter's learning about.
So you're going to do. Okay. Do you feel comfortable being transparent with the kids about how self-conscious you are? That might add a sympathy, thing to it. Because right now, those ages are very egotistical, very like, why can't you take me? What's wrong with you? You're the one that's supposed to do it because you're the mom, right? Okay.
Dad gets a hard pass.
Yeah. So is it possible for you to break down some barriers and say, you know what, this is why I can't. It's a safety issue, okay? And then this is what happened to me at Walmart. How would that make you feel if that happened to you? And I feel really embarrassed. It makes me sad, And so if you throw in some of that and be real transparent with them, they might pull a sympathy card and be more understanding. Yeah. Have you done that yet?
They've gotten
Just curious.
really used to my, well, why don't you just order it on Amazon?
Oh, you know, because mom needs to live and be outside a little bit sometimes, right? Like, and live a normal life without feeling so self-conscious and worried that she's gonna get yelled at, at no fault to hers, right? Have you tried any of that yet?
No, I haven't really, I just don't really talk about how my vision is.
Yeah. It might help. So then you don't, because I imagine, only because this has happened, and all of my examples are from real life stories that I've worked with, right? But I can only imagine that over time, when they start getting frustrated, you're going to start getting frustrated. And they're going to say, I'm just not going to take you, goodbye, right? And that may not be the best environment for a family over time when you may be dealing with this for a little while, right? Yeah. So if I could encourage you to do that, I think it might be helpful.
I think the word's new normal really resonates with kids, like, this is the way it's gonna be.
Yeah.
This is our new normal.
Yeah.
You're never gonna be able to see on that right side.
I also think it might be helpful to say, this is how you can help me, and be really specific about that. Because you can't rely on the kids, not all the kids, to come up with their own solutions on how to remedy all these situations, all these issues, right? And so if you can sit down and think about how the kids can help me help them, right? And give them actual examples, I think that'd be nice. I think it would help. Yeah. Okay. So and this was, I'm already asking, how are you doing? So.
Doing fine, thank you.
I hope this was helpful. I do want you to know that child life profession is more prevalent in large children's hospitals for obvious reasons, right? We're helping the kids get through all of this. City of Hope is one of the few adult hospitals. We have a small pediatric unit, but one of the few adult hospitals that have child life services for adults to help you with your children, any significant children in your lives. I do know that at Chalk, they're right next door to St. Joseph's, which is a large adult hospital, right? And so when in need, they do call the child life specialist to walk across the way and help the adult services over there. So I don't know where you guys are at. I do know there's child life specialists on the pediatric units at UCLA and USC. So if you're out there and you're local, reach out and say, can I at least just consult with one of them? Because this is what I'm going through right now. It might be helpful. Or wherever you're coming from, ask. And there's probably a child life specialist nearby, even one that you could probably just talk to over the phone. Okay. Any other questions? I hope this was helpful.
Very.
Thank you.